I naturally just reached down without disengaging, and I caught my hand in the snowblower. And it hurt like you wouldn't believe. Didn't hurt as bad as you would think it would, though. When I took my glove off, though, that's when the pain really was bad. I looked at my hand. It looked horrible. My fingers were pretty much removed. They were virtually gone. At that time, I went in my house, wrapped it up with a towel. I was going to call 911 for my house, but since nobody was home, I went to my neighbors. They took me to an outside facility. And they gave me a very bleak prognosis. They told me basically that they were going to have to amputate my fingers. I wanted to get another opinion, so I called some of my friends, and they recommended Dr. Kramer. And Dr. Kramer's done some wonderful things recently with this new medication that he wound up using on my hand.
Jamie came to us having just stuck his fingers in a snowblower. He was really devastated and was in shock with what he had done. We looked at the depth of his wounds, and the consideration for most people was to shorten his finger at least by one joint of the finger. So we applied the powder to see how well it would heal. We pinned his fractures, and then waiting 10 days to go back and look at it, he really had done quite well. These would have been very painful wounds had we done the serial dressing treatment, plus there was a cavity we were treating and not just the surface of a fingertip. So he had different management, but it worked very well. As we've talked about, you have lost the tendons because they were just destroyed. And so we're going to have to consider whether we're going to reconstruct the tendons or make the finger a little stiffer with a little bit of bending to it, because the tissues have done phenomenally well.